Good morning, good afternoon, and good evening, everyone. Welcome to the 353rd day of Ifph continuous Zoom session. Before starting the proceedings, let's have silence for a moment. Thank you. Today, 19th August 2021, our chief guest is Dr. Yahya, Chief Consultant, Alpha Homeopathy Medical Center, Trivandrum, Kerala, India, since 25 years. Yahya is also the Joint Secretary of the prestigious IFPH and President of the Trivandrum District Chapter of Indian Homeopathic Medical Association. On behalf of IFPH, I am welcoming Dr. Yahya. The topic for discussion is rare medicines in homeopathy. We all know that he is a rare species in homeopathy because he always defends homeopathy very strongly, very courageous. We saw the news channel discussions also. The rare species and the rare. So the topic is also very good. It's rare medicines on homeopathy. So Dr. welcome Yahya, please proceed.
Can you hear me?
Yes.
Today, so I am very thankful to the IFPH team to give me this platform today. Even though I am a daily coordinator, today I got this rare opportunity because actually a revision, we are going for a revision. So most of the doctors are my colleagues or seniors, and some juniors are with us, and this is a revision for the seniors, and you can recollect all the rare drugs. Some of them you might have used, and some drugs have been forgotten by you people. So this is only a revision. So what is this rare drug? First of all, we have to make out what are these rare drugs. We have got fully proven drugs like our mostly used drugs. So like our polycrust. Then the medium drugs and the rare drugs. So the small drugs. So these small drugs comes under these rare drugs actually. Medium drugs also I have to mention in between. Some of the drugs will come across. And these rare drugs are not well proved. That is the main theme or thing behind these rare drugs. It's not well proved. Sometimes it is obtained by poisoning or by clinical verification, or sometimes it can be used in the danger form or in low potencies. So if these drugs, when we prove in high potencies, 1 10 or 50 or 50 millimol, they will produce more symptoms. Unfortunately, in our material medicals, it is not well mentioned, and I have an advice to the college authorities or the PhD holders or the PG holders to take part in provings of these rare drugs in high potency, so that you will get more emotional and mental symptoms we can add to the material medical. So that is a request to the juniors and the teachers. So often we use these rare drugs are intercurrent drugs, or as per in the organon of medicine, the commentary, the Sarkar, it is mentioned as intercurrent drugs. So there are two ways in prescribing these intercurrents. So first of all, the Kentian school, as he is advising to prescribe intercurrents. So when we prescribe a drug for a specific condition, sometimes we will use in various potencies, 30, 200, 1. And if that drug is not working, then what to do? So we will go for this intercurrents. As per Kent, it is the similimum. It is the similimum. As he mentioned, these intercurrents are, according to the pure Kentian school, the idea of administration and the intercurrent remedy is not at all favored. Actually, he is telling he is not in favor of these intercurrents. The view is that when after a series of potencies of the same remedy, a new remedy is sought to stir up the or to develop the case. This is not an intercurrent, but at that time it is the similimum. So that is the Kenyan way of intercurrent. But as per the French school, so this is an option for the juniors to prescribe this rare drugs. As per the French school, so they are advising to prescribe these small drugs as in the tincture form or in the low potencies as drainage drugs. So that is the possible way of prescribing intercurrents. It is not at all favored by the Hahnemannian or a Kenyan school. This drainage drug we prescribe in low potencies, but at the same time we will prescribe the anti-miasmatic or the depactin drug in high potency. So these as per them, they are working in two planes, one in the higher plane, that is in the dynamized plane, and the low potency of the tincture acts in the lower plane, that is in the physical level. So I am not in favor of this second type of prescription, but when we have to palliate a case, when we have to suppress a case, so we have to opt for so many ways. So in that way, we have to, in that term, we have to use this Frenchian way of prescription, that is the drainage drug policy. So make in mind that don't ever prescribe this drainage remedy often. Try to prescribe the minimum as per the condition, and in case of difficulty, in case of failure, in case of palliation, in case of suppression, you opt for these rare drugs. So that is my advice. So first of all, we will start with, so I am not a constant user of this rare drugs. I often repertorize the case and often I try to identify the minimum. My seniors, so please excuse me if I make some mistake while narrating the symptoms or the cases. So first of all, I have to tell a drug for urticaria. We often prescribe so many drugs for urticaria like APs, arsenic album, natramur, or dulcamara, causticum, then rustobs. So many drugs we often prescribe, natramur. So in even ladambal, sometimes we come across urticaria. Suppose if these drugs fail, so what are the other possibilities? So I came across a drug called Astacus. So in the Kent's repertory, it is written in 3 marks. The first remedy in Kent's repertory for urticaria is Astacus. So I came across this. I was not familiar with this drug initially. I came across a case of George Vitolkas once. He failed in a case of urticaria. So a person came for urticaria, was a European. So a generalized urticaria, the whole body was with rashes, so which was in rosy color or red color. So he failed to prescribe most of the drugs. So he came to Vidolkas after very chronic treatment from many other homeopathic doctors around that area. So Vidolkas was advising. So I know he might have taken arsenical or natramur or apis or dulcamara. Then why should I try with these drugs? And he tried to identify a new drug which was not used before. So in that case, he used this Astacus, and he was narrating why I prescribed Astacus. So Astacus is actually, it's a remedy made from a fish. It's a crawfish. So try to understand, it is a crawfish fish, and the urticaria over whole body with itching. So generalized urticaria, nettle rash is in boric, it is mentioning nettle rash, and with the liver affections. Whenever there is liver affections in a person with urticaria, try to use this Astacus fluvialis. So that is the full name of Astacus. It is crawfish. So So he prescribed Astacus. Why he prescribed Astacus? Because the color, so the law of signatures was he used in that case. The color of the person, the color of the lesion, the color of the rash, it was in a red color, and the color of the fish was also red. So that was the matching point to prescribe Astacus in that case, and he prescribed Astacus 202 doses for that case, and the lesion was completely cured. He was telling in a newsletter of Vitolkas, this with the Astacus, that case was completely cured. So this is a case, and this is the first drug I mentioned here. So the comparative drugs already I mentioned: APs, Arsal, Rastox, Arsenical, because it's calcaric, Dalcamara, Ladampal, and Copaiva. Also, you have to think in case of urticaria. Whenever there is a in chronic urticaria in children, so that is the case of Copaiva. Whenever there is chronic urticaria in children, so we know in children what are the possible causes for urticaria. Usually, so some seafood can be the reason. Sometimes some chocolates can be the reason. Sometimes the bone trouble can be a reason for this urticaria. The poisons from worms can precipitate urticaria. In that case, sometimes we use Sina or Santonin. But if it fails, we can think of Copaiva. That is the drug of choice in urticaria, chronic urticaria in children. So then we can go for some other drugs. So I think we can narrate at least 30 drugs in this platform. So for 1 hour, the first drug I have to mention is Astacus, and the second one is yohimbinum. I think most of you people are aware of this yohimbinum, which is a drug of sleeplessness due to thoughts of past events of sexual thoughts. So strong and lasting erections. So very strong and lasting erections, yohimbinum low potency will help in such cases with sleeplessness due to thoughts of past events of sex. So that is the drug of choice in sexual complaint in yohimbinum. Lecithin, you will be aware of this lecithin. So we often lecithin low potency, especially 3x or 6, we often prescribe for anemia and neurasthenia, insomnia, convalescence. So this is a drug from the yolk of egg. So everybody is aware of from yolk of egg, and from the animal brain it is prepared. It renders milk for nourishing and increases the quantity of milk. So lecithin. So in nursing women, we can prescribe this lecithin to increase the quantity of breast milk. So that is the possible remedy to prescribe. You have to think in nursing women whenever there is less breast milk. So we can think of lecithin low potency. Often 1 or 2 doses daily for a few days will increase the quantity of milk. The next drug I should mention is Azadirachta indica, which is nothing but it is the neem. We call it as vepilla. So neem. So Malayalis are more aware of this neem. So this is Azadirachta indica, which is it's a drug for rheumatic this afternoon fever. It's a drug of choice of afternoon fever, and scabies. We often prescribe Azadirachta indica for scabies, skin complaints, which is very effective. And for rheumatic complaints also, we often prescribe Azadirachta indica. Rheumatic pains, then afternoon fever and scabies, you can think of Azadirachta indica. So don't go for Azadirachta indica in these cases. You have to try the polycrus or the indicator remedy as per the symptoms. Whenever you fail, you as an option think of Azadirachta indica in rheumatic complaints and scabies. The next drug of choice is Nuphar-luteum. Nuphar-luteum, N-U-P-H-A-R, Nuphar-luteum. So it is again a drug of choice for sexual complaints, impotency with involuntary emissions. Impotency with involuntary emissions during stool and while urinating. So during defecation and during urination, if there is involuntary emission, you can think of Nuphar-luteum. Nuphar-luteum is a drug for sexual complaints. So initially I mentioned about the yohimbinum. So in strong and lasting erections, so Nuphar-luteum for impotency, you can think of in sexual complaints. Then hedoma. Hedoma, most of you are aware of hedoma, H-E-D-E-O-M-A, hedoma. So whenever there is, when we think of renal calculus, so often we think of Berberis, vulgaris, Lycopodium, Ocimum canum, Sarsaparilla. So these are the drug of choice. So hedoma, you have to think whenever there is a left-sided complaint, whenever there is left-sided renal stones, you can think of hedoma. So we often know Lycopodium is right-sided. So along with the Lycopodium, you can think of Ocimum canum in right-sided renal stones. But when we think of left-sided complaints, we often think of Berberis. So hedoma also, you have when this Berberis fails, as an option, you can think of hedoma in kidney stones, in renal stones. So the other indications of hedoma is red sand. So like Sarsaparilla, it is red sand in urine and pain along the ureter. That is the pain along the ureter and left-sided complaint and inability to retain urine for more than few minutes. So the patient can't retain urine. So yeah, every 50 minutes, every 10 minutes, the person have to go to urinate. So that is the indication of a hedoma. So low potency will often expel these stones. So try to make out the point. Lycopodium, right side. Ocimum canum, right side. Berberis vulgaris, left side. Hedoma also is a left-sided remedy. Okay. Then Ferrum picricum, it is a medium drug. It is not a rare drug. It's a medium drug. Ferrum picricum, again, it's a drug of choice in prostatic complaints. So we often think of Sabal Serleta, Chimaophilia, Pereira breva, often in prostate complaints, along with the Apis or Conium mac or Medorinum or Oromet or Spongia. You can think of Ferrum picricum in senile hypertrophy of prostate, senile hypertrophy of prostate with the frequent micturition at night. With a full feeling and pressure in rectum, smarting at the neck of bladder and penis. So I remember AKB, he prescribed this Ferrum picricum in the case of warts. So it's a very effective remedy for warts of hands. So that is a rare prescription I saw in a case of warts. So it also helped for warts. That is another indication of a Ferrum picricum. So Chimaophilia ambulata and Pereira breva I am not mentioning because already it is everyone knows about Chimaophilia and this Pereira breva in prostatic complaints. So if juniors are present, please you can add your therapeutics, Chimafela and Parerabreva for prostatic complaints. Then vaccininum. Vaccininum is a drug of for vaccinosis. We often prescribe vaccininum. So very rarely we prescribe vaccininum. But nowadays, now in the era of vaccination, so without mentioning vaccininum, we can't go across. So we know there are so many drugs in Kent or in the synthesis repertory, so many drugs for vaccinosis. So I should mention some of the drugs for vaccinosis. Melandrinum is one of the major drugs for vaccinosis. Meserium is another drug. Sarsaparilla, Cilicia, sulfur, thuja, tuberculinum, vaccininum, verulinum, antitat, apis, iserical, belladonna. I remember. I remember a case of Vitulkas again. A lady of rheumatism. She was complaining of arthritis, very chronic arthritis. She came to Vitulkas and he failed to prescribe the indicated drug in that case. After 2 years, he identified a drug. Again and again he took the case, and while come across the symptoms, she told a symptom which was so specific. She had to go for urinate while seeing tap water. So when a tap is open, she had to run to the urinal. So that was the indication for a drug to George Vitulkas. He identified. So immediately he asked her whether she was bitten by a dog. Yes, I was bitten by a dog. And then again, a confirmatory question he asked, whether you took the anti-rabies vaccine. Yes, I took anti-rabies vaccine. Immediately he prescribed hydrophobinum for that case. See how this vaccinosis affects, and there is some logic in prescribing drugs after vaccination. That is why I am mentioning this case, because whenever we think of vaccinosis, immediately you will tell, okay, Cilicia or thuja. No, that should not be the policy. So you have to take the case and you have to identify the symptoms. So again, I will narrate another case. One case 20 years back, she's a girl of 6 or 7 years. Actually, that girl was a daughter of an anatomy professor from the medical college, in Trivandrum Medical College. And they came to me for constipation in this girl. So they tried so many purgatives for months without any effect. And I took the case, and I know we know there are so many drugs for constipation, plumbamet or opium or bryonia, naxomica, Cilicia, thuja. So, and that lady, she was a doctor, and she knows how to tell the symptoms, and she was fond of homeopathy. That is why she came to me with her daughter, and she told me, so this constipation precipitated after vaccination. So I think MMR or some vaccination was went for at that time, and after vaccination she developed this constipation. So the drug of choice was Cilicia then. Cilicia or thuja we can prescribe, and with the constitution I prescribe Cilicia. So this should be the policy of when we think of vaccinosis. I should mention melandrinum. When to prescribe melandrinum? So whenever there is when skin complaints, whenever there is a fever after this vaccination, any vaccine, you can think of melatonin. Whenever there is neurological problems after vaccination, you can think of meserium. So that should be the drug of choice. The tuberculinum. So whenever there is a fever after vaccination, you can think of a belladonna and tuberculinum. Where if it precipitates some bronchial complaints, some cough or asthmatic complaints along with the fever or asthma, you have to go for antimonium tartaricum. So the drug of choice for a vaccination, vaccinosis is antitat if there is respiratory complaints after vaccination. So you have to take the case in detail and you have to identify the drug with the symptomatic. Don't go for a Cytitia and Thuja alone in the era of vaccination. No, you can expect more and more case in the coming years or the coming months. So try to understand the drugs: melandrinum, meserium, sarsaparilla. Sarsaparilla, if there is a urticaria or a skin complaints, or if there is a urinary complaints after vaccination, think of sarsaparilla. So the drug of choice in urinary complaints. So if there is a renal complaints, the drug of choice is sarsaparilla. Cytitia, sulfur, thuja, tuberculum, vaccininum, verulinum, antitat, APs, arsenic album, belladonna, and hydrophobinum. At last, hydrophobinum. There are so many other drugs also in synthesis repertory. There are in 1 mark so many other drugs also of choice. So you go with the synthesis repertory so that you can get more collection for this vaccinosis. Then trifolium repens and trifolium pratens. Are you aware of this trifolium repens and trifolium pratens? So whenever you think of tialism, whenever you think of mumps or a salivary gland affection, you will often think of mersol, Cytitia, pyrrhotidinum, pilocarpus, or quinium mac, phytoleca. Such drugs are of choice. But I studied this drug in a case of salithiasis. So a person 20 years back, a person came to me with a right-sided salivary calculi. At that time, I found the Cytitia was the drug of choice to that person. I tried Cytitia 200 daily 1 dose for 2-3 days. Then I tried one weekly dose for many months. So whenever he start eating or whenever he think of food, immediately there is a swelling of the right salivary gland, this parotid gland, and there was immense pain, and there is he was in utter confusion, and immediately he will come to my clinic. Doctor, this is the type of swelling, and please help me. So I was very confused, and I have no choice actually. And I consulted with one of the senior doctors. He was a retired CFO, and immediately he told me, why can't you try trifolium repens? So I was hearing for the first time that drug, and immediately I searched in the Bori, and it was in some relationship it was mentioned. This trifolium repens and trifolium pratens. Immediately I prescribed this trifolium repens tincture for that person. So to my surprise, after 1 week, that person came with a paste-like product. So from the right salivary gland, like a toothpaste, Colgate paste, this stone, actually it was softened and it was ejected to the mouth. So don't forget this drug, trifolium repens, along with the other drugs like I'm again and again I am mentioning, go for the polycrust and the indicator remedy when it fails. So I tried this because I fail in prescribing with Silesia. And I have one more experience with this trifoliate repels in another case. So actually, this silithiasis is a very rare condition. This Silesia and Quiniamac and Phytodeca and Calcareca often be prescribed. So whenever the symptoms of for this trifolium repens is it is a prophylactic against mumps. So actually, we prescribe pyrocarpus and pyrrotidinum as a prophylaxis. So this pyrrotidinum and pyrocarpus, in my experience, I never fail in prescribing or in preventing mumps with this pyrocarpus and pyrrotidinum. In often in 100% success, I got with this pyrocarpus and pyrrotidinum. In this case, this in trifolium repens, Boric is mentioning it's a prophylactic against mumps and with the profuse salivation. So and words lying down. So words lying down and the taste of blood in mouth and throat. So that is the indication of a trifolium repens. So taste of blood in mouth and throat. Trifolium pratens, it's also tiresome. This is a profuse salivation with the cancerous diathesis. When if the person is having a cancerous tendency, you can go for this trifolium pratens with the congestion of salivary glands. Next, we should mention about the Ikshugandha. Ikshugandha, I know most of the doctors will prescribe Ikshugandha. The other name for Ikshugandha is Tribulus terrestris. Tribulus terrestris. So, in infertility treatment, we often prescribe this Ikshugandha for sexual neurasthenia. And whenever there is a disturbance in semen, whenever there is pus, more pus in semen, whenever there is oligospermia, so Ikshugandha often gives results in low potencies. This semen disturbances often is managed with Ikshugandha or a tribulus. So whenever there is oligospermia, you can prescribe Ikshugandha. Often low potencies often helps. Okay, thiocinaminum, that is another drug of thiocinaminum. Thiocinaminum, in these 350 days, we came across in so many instances this thiocinaminum for dissolving scar tissue, for tumors, for enlarged glands, for lupus, strictures, then additions. So after appendicectomy, if there is a addition, we can think of thiocinaminum. Opacity of cornea, that is for for eye problems also, we can think of thiocinaminum. For fibroids, thiocinaminum is prescribed. Scleroderma, thiocinaminum is mentioned. It's a medicine for retarding old age. So those who want to be young, you can take thiocinaminum now and then, so that you will be as you look now, like Hubert or Dr. Manoj. So if you take thiocinaminum now and then, you will not be old. So that is the drug of choice in so for retarding your old age, so thiocinaminum you prescribe. Symphoricarpus also. This is a very interesting drug to help ladies during pregnancy. This is Symphoricarpus, vomiting of pregnancy, worse any motion. So like Bryonia, whenever she moves, she will vomit. So Bryonia is a comparison for this is Symphoricarpus. Aversion to all food, better lying on back. Better lying on back, and there is aversion to all foods. So there is anorexia, at the same time aversion to food, and worse by motion is an indication or symphoricarpus when bryonia fails. So that is symphoricarpus along with you can think of Naxomica, bryonia, sepia in morning sickness. So during vomiting during pregnancy, symphoricarpus. Medistica is Medistica sebifera. So when we think of a Hepar or Cilicia in Panartium, so whenever there is a pus collection, or whenever there is abscess, whenever there is pus under the nails, so the tip of nails. When Hepar and Cilicia fails, you think of Medistica sebifera, Panartium. The symptoms are pain in the fingernails with the swelling of the phalanges. So then it hastens operations and shortens its duration when Cilicia and Hepar fails. I tried this Medistica so many times in my college days. I should mention a case. There was a submandibular abscess. There was a case of a submandibular abscess. In that case, the medicine department was managing that case actually. I remember a girl of 5 or 6 years. She was complaining of immense pain with the swelling, and there was a red swelling about to burst. So that girl was with a great agony with this pain. There was a sleep and a continuous crying. That girl was continuously crying, and the head of the department prescribed Hepar for that case, but it failed. Cilicia was prescribed, again it failed. So I am not mentioning about the Medistica. Yeah, in that case, so that swelling was about to burst. So I inquired the case with the CMO at that time, and he told me to prescribe tarantula. So I learned the tarantula in that time, tarantula cubensis. So actually it was not in the syllabus. Tarantula cubensis, one dose. In the IP or in the OP, it was I think we rushed to the pharmacy, and there was tarantula 30 at that time, and we collected that tarantula 30 to that patient, and it was in the evening it bursted like anything. So I remember I learned tarantula, and whenever there is excruciating pain, we can prescribe tarantula. So when Hepar and Cilicia fails, or this Medistica actually when Hepar and Cilicia fails, you can think of Medistica. At the same time, bear in mind this tarantula also of drug of choice. Then Solidago is the next drug. When we think of kidneys and this kidney stones, so I often prescribe this Hedoma, Solidago, along with the Lycopodium berries, when the drug of choice for me. So I often manage kidney stones in my clinic, and the drug of choice was Osimum in some cases. Very rare prescription, this Osimum. Hedoma, Solidago, Gallium apparent is I often prescribe. Then terebinth, urea. So in the choice of Solidago, so the symptoms are kidneys are sensitive to pressure. That is the symptom of Solidago. Reddish brown thick sediment. Reddish brown thick sediment. So the gravel, clear and offensive urine. So to prescribe Solidago, clear but offensive urine, and there is a brown thick sediment. If there is brown thick sediment, you can think of solid agar. Okay. Next is castor oil, Ricinus communis. So you are aware of Ricinus communis, which is nothing but castor oil. It increases the quantity of milk in nursing women. So this Ricinus communis you can prescribe it for nursing women to increase the quantity of milk. So for profuse vomiting also, this Ricinus is indicated. Ricinus is indicated. Then Quercus is everybody is aware of Quercus glandium spiritus. So when you think of de-addiction, you can think of Quercus. It takes away the craving for alcohol with the dropsy and liver affections. So if the person is having liver affections after continuous drinking with the dropsy or with the spleen complaints, it antidotes the effects of alcohol. It antidotes the effects of alcohol. So Quercus. Daphne indica is another drug for a tobacco de-addiction. Daphne indica. So Quercus and Daphne indica, don't forget. I think it is 8:45.
Yes.
So whether I have to continue or we can go for a discussion.
No, you have to continue in several sessions, not one or two sessions. Now I think we can have a discussion. Then have to go to the next session at 9 o'clock.
Okay. Because I have 200 drugs in my collection. For only 30 drugs today I prepared, and just because more seniors are here, and I think better go for a discussion so that I can also learn from them. Okay.
Yes. Those who are interested to participate in discussions can please go to the participant list and raise their hands, please. Anyway, it's a nice discussion, wonderful one, well compiled one. It's, I think, when we go to the homeopathy, it is the 7 wonders of world are nothing in front of homeopathy. When we study bacterium medica and cases, I think we cannot explain. The 7 wonders can be explained, but this wonder we cannot explain. So it's a very nice discussion. Then another one is the vaccination about is told. There is also an important thing that the symptoms are of prime concern there too. Even though the cost of vaccination is there, but as Dr. Yahya says, you should give the medicines not on the basis of only vaccination, but on the basis of symptoms what the patient presents. There are a lot of things to come in the later days we can expect. Now Dr. Kamal Shah is there. Dr. Kamal Shah, please unmute yourself.
Thank you, Dr. Manoj, for giving me this chance. Assalamualaikum, Dr. Yahya. I would like just to confirm, you mentioned just now hyoscyaminum?
Thiocyanamide. THI.
I can't get that. What's that again? How do you spell that?
Thiocyanamide. THIOSINAMINUM. Thiocyanamide.
Could you please put in the chat box so that we don't get THI.
Okay.
I'll write.
Okay. I got confused, because I thought it was hyoscyaminum.
No.
Sounds.
Okay, you please listen the chat box.
Okay, thank you. And one more thing I'd like to ask.
Okay.
When you mention vaccine, you also mentioned silica, melandrinum, and all the rest. The question is now, in this time of COVID-19 pandemic, do we have actually a remedy, a medicine that can eliminate the vaccines given by our governments from our body? Do we really have one? Thank you.
Yes, in such situations, if there are no symptoms, you can think of Tuja and Silesia. If there are no symptoms, if they come with the symptoms, then you have to think of other drugs of choice. So blindly you can prescribe either Tuja 1M or 10M or Silesia 1M or 10M if there are no symptoms. That is my opinion. So if other senior doctors can add.
Yes. I am remembering your words, Dr. R.P. Patel said, when the patients are seeking advice from him whether to vaccinate or not, he advised patients to take vaccination. Then after vaccination, he gives Tuja. That was his method. There is no other options, but he want to save the patient. At the same time, want to do something. So now, Dr. Hariharan Narayana, please. Please unmute.
Okay, Dr. Yahya, your class is fine and your observation is, can you hear me?
Yes.
Yes, please.
Your class is fine and your observation, see medicines, certain medicines are very effective, what you said. One of my question is, see, do you have any experience or any medicine in your mind which will act on retina?
Tina.
Any
So-
medicine?
So any medicine which can act on nerves. So also like Ruta, we often prescribe Ruta.
No, not that is not. I want to know any medicine which can act
Specific.
on specific on retina.
Specific. So I can't mention now. So
Doctor, if you have some suggestions, please give your
yes,
suggestions. Doctor.
in your mind, if some drugs are with you, please mention.
See, I don't know any medicine, but I want to know anybody knows.
Okay,
Let me know. Let me know the medicine, which is the medicine. Any
Okay.
medicine?
Okay, let's hope for best, doctor. Somebody will give you answer. Okay, please wait.
Okay. See, another thing, for information, I want to inform you that, see, you told that fibroid, thiazolinum is very good for thyroid. I mean, fibroid. Yes, it is very correct. But one thing is, see, after the surgical intervention of uterus, certain ladies have the scar tissue in uterus, at uterus, and it will be cured by thiazolinum.
Yeah.
And on examination, the US scan, they will say it is a fibroid, but actually it is not the fibroid, but it is only a scar tissue. So this thiazolinum will do very good effect upon that and
Yes,
can be
yes.
cured by this.
Yes.
Okay.
Thank you,
For
thank you.
information, I am telling that.
Okay. Well, that establishes the miasmatic theory. Psychosis is the cause. Always hypertrophy of scar. We all know that. Okay, now Dr. Hubert, please. Come on.
No, doctor. Very nice class. Very nice. I want to add something. For pain in ears, there is pustules forming. Calcarea picrata. Many medicines I tried, but failure. That time, Calcarea picrata was wonderfully effective because there is no muscles in the skin and bone only. It can that time give immediate result. Immediate not, within some time we will get some relief in such pain. It is very terrible pain. Then another one asking something about the retina and eye problem. Strangulation of blood vessels in the eyes, argent and nitricum and calcarea carb is useful. That may clear some of the complaints. These are the two things I want to share with you.
Thank you.
Very interesting class, very interesting, very
Yes,
informative.
sharing is always welcome. Now, Dr. Rubira, please. Please unmute yourself, Dr. Rubina.
Another one thing also I want to say that the Tuja Vannam for vertigo after vaccination, within minutes we will get a relief.
Okay, thank you. Dr.
Hello, sir.
Rubina? Yeah.
Yes, sir. Good evening. Thank you very much for the class and for the knowledge you share. I had a question. Do you have any specific for PCOD cases where there is prolonged suppression of menses, where women get anxious if they don't get their periods on time, and vice versa, like the females who get continuous bleeding or spotting, to stop that? Any specific? And the second question is, I have heard of the drug Galaga, mother tincture, in cases of PCOD to be used as a specific. So can you comment on that drug? Thank you.
So PCOD, actually better you go with the indicated polycrust. So that should be the drug of choice. And for a dysmenorrhea and for some of the acute problems in between, you can go for this rare drugs or small medicines or tinctures. Better calcarea carb or Tuja or sepia or Natramo, such drugs often comes. So better go for the indicated polycrust after taking the case fully. So don't try these shortcuts in PCOD. Better that should be the choice. So anybody can have any other suggestion, please, you can mention.
Okay. Now, Dr. Hariharan once again, please. Please unmute yourself, Dr. Hariharan Narayana. Are you there? Yes.
Hello, doctor. See,
Tell me.
triple S is a wonderful remedy for benign benign prostatic enlargement. Triple S is very important medicine. Anybody can try that medicine for prostatic enlargement. In my experience, it is a very good remedy.
Okay, doctor. Dr. Rajan.
Doctor,
Yes.
please, doctor, any retina? I have not heard that medicine.
Doctor, please stay with us. Please, you get the answer. Please wait. Dr. Rajan, please, come on.
Hydrastis more 3x. Hydrastis more is very effective in recurrent attack of mouth ulcer. Also used for bleeding from fibroid. Hydrastis more.
Okay.
So, calcarea lactophos is one of the best remedy for migraine, cut short migraine. Calcarea lactophos.
Okay.
Ammonium causticum, hoarseness with the cough. After severe cough, affecting hoarseness, ammonium causticum.
Okay.
The sangusiga, that is our atta, is bleeding piles. Sangusiga 30.
Okay.
How many medicine? Desmodium, severe headache with viral fever. Desmodium.
So I think, doctor, you have a lot of information about this, so you can have some presentation later, I think. I'm welcoming you.
Yes, I'll answer later.
Don't hesitate, doctor. Okay. Now,
Thank you.
Dr. Ajit. Dr. Ajit, please unmute yourself. Please unmute Ajit. Yes.
The medicine for retinal detachment is naphthalene.
Okay.
The specific medicine.
Oh, thank you. Dr. Hariharan Narayana got the answer.
Produces a detachment of retina
Okay, thank you.
and papilloretinal infiltration.
Good. So thus it becomes a platform to rectify our doubts. Thank you, Dr. Very much. Thank you. Because we are desperately asking for our I think Dr. Sima Pilser is there from Turkey. Madam, what is your opinion? Are you there? You can unmute yourself. Dr. Sima Filsar from Turkey. Oh, yes.
Yes. Unmute yourself. Unmute yourself.
Please unmute Dr. Sima Filsar. Please unmute. Okay, thank you. Come on, madam.
Okay, finally. I finally succeeded in unmuting myself. Thank you. Dr. Yahya, thank you very much. This was an excellent presentation and I really took a lot of notes. But as far as I could understand, frankly speaking, I would have benefited more if there were some written notes about it, because I could understand some part of it and I tried to write down as far as I could understand, and I will look them up later, but especially about the, which one? Trifolio. It really attracted my attention because I had such a case while I was practicing as an allopathic doctor, and we couldn't find a certain remedy for it. So now I know there's a remedy that exists in homeopathy. Thank you for that. And also for the urticaria, I also looked at it up, and it really gave me such an insight of what can be done and about the rare remedies that really help for the cure. Thank you very much. And it has been a very beneficial lesson. And as I told you, it would have been better for us as the foreign doctors if you could write at least the basic names, if possible.
Sure. Okay, thank you.
Sure.
Yes.
Thank you very much.
Always keep in touch with us. Thank you, madam. And Dr. Mohammed Masani, doctor, please ask your question as well as the word of thanks, Dr. Yahya. Masani, doctor, please. Are you there? I think he's left. Okay. Dr. Sima, sir, could you please say the word of thanks?
Yes.
Yes, Masani came back.
Let's talk. Dr. Sima, sir, please.
There is, I think, one more hand raising by Dr. Masani.
Yeah.
Oh, Dr. Masani can speak now, sir. Let us
Mute. And we can unmute by yourself, Masani. Please help him.
It also happened with me.
Which is the medicine for retinal detachment? Some doctor mentioned it.
Yes, naphthalene. Okay,
naphthalene. Another medicine for retinal hemorrhage, arnica is a good medicine for retinal hemorrhage.
Okay.
Retinal hemorrhage, very good medicine for retinal hemorrhage. Very experienced doctors cured the retinal hemorrhage using arnica. Montana. Okay.
Yes.
Thank you. Okay. Madam, please proceed. Lot of thanks.
Dr. Yahya, I really am grateful to you for providing us great insight with your great experience in the rare remedies. And it really has helped me a lot. And it really helped me to see that homeopathy especially really is a great choice in these kind of rare remedies and rare cures, that it gave me extra encouragement to study more and more. Thank you very much. And thank you to IFPH for providing us this platform. I can see from all over, from Turkey to your country to eachwhere in the world, we can join and gain information. This is the greatest chance of all, and it's taking place every day. And thank you to all the ones who participate and also who make all the efforts to make us learn more and more about homeopathy. Thank you very much.
Yes. Well, that was the end of the 353rd day of our session. So it's time to go to the Malayalam session. All those who participated in Malayalam sessions can continue. Thank you. Dr. Sanesh.
Thank you.
Thank you, Dr. Manoj. It was a wonderful presentation here. And